Welcome to everyone. Good morning, afternoon, evening, depending where you are. This is the third in a series of 6 sessions at Humanitarian Networks and Partnerships Week on accountability to affected populations. The series is being organized by IASC members in collaboration with PHAP, and we're really looking at how we can strengthen accountability to affected populations, or AAP, and how we can bring about the participation revolution that was envisaged in the Grand Bargain. As I mentioned, this is the third. We had one yesterday on Every Contact Counts, intentional accountability through the program cycle. This morning in Geneva time, we had one on AAP and humanitarian data responsibility. Tomorrow, we'll have one on empowering frontline staff to deliver accountable, and locally driven humanitarian assistance. Thursday, we'll have the launch of the Accountability and Inclusion Help Desk. And next Monday, we'll have a hybrid session, so in person in Geneva as well as online, about what should we change for greater accountability to people in crisis. And we'll have the time shown at the end as well. And I see that many of you are starting to introduce yourselves. That's great. Please continue to do so, and make sure that you do add any questions to the Q&A. So today's session on social sciences for community engagement in humanitarian action, or the short form of SS4CE in HA. It's a bit of a mouthful, so we'll see how the speakers manage that, is very much about this work that's been done in collaboration with more than 70 plus humanitarian partners across humanitarian practice and academia. And the project's aim was to strengthen global and regional demand for social science integration into humanitarian programming that will help to better inform and facilitate community engagement of affected and at-risk communities throughout the humanitarian program cycle. And that engagement would help us to then better respond adaptively, rapidly, effectively, and efficiently to humanitarian emergencies. So today's session is going to explore some of the co-created global goods that will deconstruct concepts around decolonization, social justice, and localization. And they specifically look at how we can address current practices with recommendations for action that can help to drive systemic and intentional resources to address people-centered and community-led humanitarian action around the application of ethics of data sharing, capacity needs and competencies, and community engagement data systems. We're going to have 2 country examples, an engagement from Syria and Haiti, and that'll show very much how social sciences or multidisciplinary insights can improve humanitarian programs and better delivery and support of who and what exists in country already. So I'm going to quickly introduce our panelists before I start turning to them. First, we're going to have Rania Elasawi, who is the Social Behavior Change Specialist at UNICEF. We have Sahar Hagazi, who is Chief Social Behavior Change in the Syria Country Office, also with UNICEF. We have Romeo Ngana, who is Community Engagement and Accountability Delegate in Haiti for the International Federation of Red Cross and Red Crescent Societies, IFRC. We have Fernanda Falero, who is Social Science and Social Behavior Change Specialist with UNICEF. Jeffra Fulane, who is the Coordinator of Research and Capacity Strengthening at IFRC. Those are our panelists, but we also have Ginger Johnson, who is Research Specialist, Social Behavior Change, as part in the Collective Service, which is a partnership between UNICEF, IFRC, and the World Health Organization. And Ginger is going to be helping answer some of your questions by typing them live. And I do encourage all our panelists, as the questions come in, to type as many answers as you can, but we will have time towards the end for Q&A, so we'll be able to pull your questions. And with that, I am pleased to hand over to you, Rania, to give us an introduction to social sciences for community engagement in humanitarian action, please.
Thank you so much, Manisha. Yes, it is definitely a mouthful. And so thank you for all the patience with the acronyms, but I think we're very much used to this in the sector, fortunately or unfortunately. But so I'm really pleased to be able to present and start to kick off this session basically and to talk about why we're here and why we're talking about social sciences for community engagement in humanitarian action. And with that framing, I want to just set the tone within the 2030 agenda and the context of the 2030 agenda. I think that everything about community engagement and participation and the meaningfulness of those processes is grounded in this agenda, particularly when it claimed that everything that we are aiming to do is to ground ourselves within global commitments around ownership and elevating progress towards the Sustainable Development Goals. And that cross-cuts humanitarian to development programming. And so if we acknowledge people as co-holders of power, what are the types of commitments that we need to make to also strengthen meaningful participation and engagement? And it's within that context and framing that everything that we've been doing and the evolution around community engagement that has been happening over the last few decades has been accelerating, particularly over the last 10 years, I would say. So setting that tone, and sorry, I'm just getting used to my slide clicker. Okay. Setting that as the tone, we know that within this context that there have been many challenges, but these challenges also pose so many opportunities. There have been so many limited as well as diverse understandings around community engagement and the role that it plays within humanitarian contexts. In addition to the generation and the utilization around social sciences to inform community engagement. There are a lot of issues around then integration processes, as well as the investments and the resources and decision-making processes that support community engagement efforts into programs. So framing that, there have been many efforts to work on the standardization as well as the contextualization of community engagement and what that means in terms of commitments to meet governance as well as development, humanitarian, including public health responses within the current times that we are in. So within that, the way that we aim to frame or understand community engagement is at an intersection of several global objectives, but in particular in regards to these specific areas that our institutions that work within the international development and humanitarian space aim to work within. So community engagement is seen, it has actions, it has goals, it has benchmarks within these specific areas. They drive sector-specific objectives within social services and public sector, such as health, education, child protection, etc. But we also anchor them within governance processes and objectives that cross over transparency and trust building, aim to strengthen our systems in terms of preparedness, implementation within governance systems like decentralization, etc. So the intersectional nature that community engagement practice has, it requires meaningful integration in terms of a set of standards, understanding, project cycles, the methodologies, the approaches, how do we integrate, and what are specific coordination, as well as, most importantly, financing and resource mobilization that are attached to that. So placing that within the current context and its application, we have been working as UNICEF with these partners over, I would probably say, the last 8 to 6 years. Yeah, I would say since the West Africa Ebola crisis in particular, there have been many accelerated efforts, particularly for us to generate a common understanding around community engagement. And as we approach it, that there is an imperative that communities are a co-holder of power. And in that process, what we did develop over a 2-year span during 2018 to 2019, and as a joint effort also of many interagency. It was an interagency process, and many partners that are working across the development and humanitarian context, was the development of these community engagement minimum quality standards and indicators. I won't go into too much detail about that because you can actually access this as a global good online, but the framing and the development of these standards was very critical because it was just to drive a consensus to have an understanding that through the adoption of minimum standards, as well as possible indicators, that this could drive transparency and trust processes, and to drive also more comprehensive and response-wide application of community engagement, particularly during humanitarian crisis, and that this would further efforts around accountabilities. So these are a set of 16 standards. Please do, if you have not heard of them, but hopefully you have, look at them. And the idea around them, and most importantly, is how they become understood, internalized, institutionalized, and operationalized by the different partners and stakeholders in order for us to view communities as co-holders and not just recipients of power. So this was the framing of how we led to the Social Science for Community Engagement in Humanitarian Action initiative that we launched actually during the times of COVID. We all know that, in times of crisis in particular, there is so much onus and pressure on communities in particular. And so the idea behind this project was for us to think about some of the progress that has been made in terms of community engagement, but how do we further accelerate those efforts to strengthen what informs community engagement programming, and how do we define those actions further? The idea behind the initiative, therefore, and the continuity of the interagency efforts, and it would be remiss to mention that, it's 70 plus partners, just to put a number to it, but there have been so many more coming in and out and engaging with us at country level, at community level, through civil society partners, through academic platforms and networks. So there have been even more than that, I would say. So what we aimed to do was to develop, there were three pillars around this. The development of technical guidance for us to further establish better standards and understandings around how do we strengthen, what do we mean by social science, what do we mean by the capacity that's required to influence community engagement programming. The other pillar was for us to establish specific principles for how we deliver, and that specifically looked at ethics, data sharing, and codes of conduct. And the third pillar was looking at the community engagement data that we collect, generate, and utilize, and how do we strengthen that and be more systematic within what we do. So we try to ground this within the context of humanitarian programming. So there is a humanitarian program cycle, and sorry for the very small visual, but the idea is that at every stage of humanitarian programming, whether we're thinking about preparedness or we're thinking about recovery, community engagement is happening. There are many community engagement processes and actors and stakeholders. So how do we standardize, but standardize enough that it is contextualized when we are engaging with communities? How do we think about it from a systems approach and from the institutional accountabilities approach? So what we aim to deliver within the global goods is to define specific actions at every moment of the humanitarian program cycle. So at preparedness phase, what would we need to do? During a response, right at the needs assessment phase, what kind of information are we trying to leverage and drive? And so that was what we aim to do to ground this. This is just, I'm not going to go through this, but just to show that this is the diversity of the different partners that were engaged in this project. The foundational considerations of this initiative really look to begin to unpack three pillars. One, looking at the approaches that are left out of the system when we think about community engagement. So how do we integrate a decolonial and feminist approach and establish understandings around justice, inclusivity, and equity, and break the cycles of power and the systems of power that influence decision-making. The other one is contextualization and understanding and acknowledging that there are diverse knowledge systems, and we need to accelerate progress to incorporate those and integrate them and ensure that we leverage them and acknowledge them. And then how do we institutionalize this? How do our different institutions make the changes within the systems to influence organizational change and look at our competencies and the skills that we have to drive these? So the last two slides, which I will not read through as well, but just to share that we do have a set of global goods. They are centered around ethics, data sharing, and code of conduct. There is another set around capacity development, where we mapped out trainings around social science and community engagement, and we also looked at skills and capacity needs. And then the last set was around community engagement data systems. How do we capture community engagement? How do we understand how we drive decisions through the data that is collected? And then we propose a common M&E framework that can help us to accelerate those changes within our institutions. I'll pause there so that we can move to the next part of the presentations and the exciting part of the implementation on the ground and what we can do with this. Thank you. Over to you, Manisha.
Thank you so much, Rania. It does seem like there's been a lot of work done in the context of the project and a lot of great sort of products and things that are coming out. Global goods, I'm assuming, are kind of products and tools that are going to be useful, hopefully, for many others across the sector working on accountability to affected populations. Thank you for that. And I would encourage all of you in the Q&A, you'll see we've already got a number of answered questions. Many of those were submitted in advance of the session, but have already been answered. So there could be some very similar answers and questions for those of you who haven't taken a look. Please do. And we will come back to some of the questions that are coming up. One of them is about the presentation being very theoretical. Could you please make some concrete examples? And we're about to do that. So Rania was providing the framework, and now I'm going to turn to Sahar, who's the Chief Social Behavior Change in the Syria Country Office of UNICEF. And Sahar is going to talk to us about the importance of social sciences for community engagement from the perspective of the Syria program. So taking the theory and into practice for us, please. Sahar, please.
Thank you very much. And thank you very much, actually, for the invitation, for being here today with you. And I'd like to start, first of all, by thanking all humanitarian workers who've been on the ground in Syria since the beginning of all the different crises until today, and the most recent one of the earthquake. I also would like to thank all my colleagues who've been part of everything I will present today. So it's not entirely me, it's everyone and all our partners, national or international. I think before we start, it becomes very difficult to understand and appreciate how can we contextualize community engagement and start working on social science within that and leveraging it without looking at a very quick timeline of different crises of more than 1 decade that had been taking place in Syria. It started all, as many of you are aware, in March 2011. By July 2012, it became fully announced as a civil war, touching every corner of the country. And the situation has been changing every day, actually, and every week, with different parts of the country being dominated by different groups on the ground. The reason to mention this, which is very important to keep in mind, is to remember how those communities have been facing and struggling and addressing different kinds of dynamics, power struggle, political and otherwise, while they have to deal with their daily life. So by basically 2014, we had 45% or even more of the Syrian population officially displaced, in addition, of course, to hundreds and thousands of people killed, and more than 10 million who were residing in dire need of humanitarian response. And that's, of course, not to take into account the ones who have been already accounted for outside Syria. By 2016, as you could see from the map, the situation has become even more problematic, with more and larger parts of the land under ISIS. That's more on the pink side, and patchy areas by different groups, without getting into the politics of that and the details. But again, this is just to tell you that one city like Aleppo, who's the second most important or third most important in the country and a trade center, has been cut in different parts by different groups, where those communities that we are supposed to be serving and supporting are being cut across different groups, and they had to deal with different realities every day. By 2018, the situation has started to become a little bit better, and more as we were progressing into the last 2-3 years, there had been a larger government control over the entire area, except again that yellow parts on top, which is more under the Kurdish authorities. But then still there are patchy areas in black, as it's shown, still under ISIS, as well as the opposition on northwest side. However, this did not end all crises, because if we just take a very quick toll of the situation again, by 2019, for example, you had more than 5.5 million outside Syria. The number of internally displaced jumped to 6.2, people on the move as well. And of course, children were very much part of that crisis. Unfortunately, with the improvement of the political situation and a lot of aspiration and hope for peace to become more of a reality for the Syrian public, another crisis just hit the door with COVID-19. But that crisis comes at the time when we had more than 70% of the health workers already who have left the country. The hospitals and facilities and testing all were not up to, as you could imagine, after such a long war, ready to accommodate a major pandemic as COVID-19 was. Hence, a lot of the underreporting was also due to the fact of lack of resources and capacities that were available. By 2022, another major outbreak hit the country again, and unfortunately in the same northwest, northeast and northwest, and some of the north parts that were previously under non-government control areas. And of course, those were mostly among the most in need areas and most of equity problematic areas like Deir ez-Zor, Idlib, as well as governorates of Raqqa. February 6 hits a major earthquake, one of the biggest that the region has seen in the last 100 years, probably or more. It had created a huge toll for both Turkey and Syria. Again, the same strip of the land in North Syria was the one that has been most affected. Now, coming and looking in early this year, how can we work on initiating social behavioral change or community engagement in such a context and do respond as effectively and as quickly in such a situation was a big question, particularly for myself, who just landed only 10 days before the earthquake itself happened. But there were some realities that we had to deal with from SBC or from a community engagement point of view. First, the multiplicity of data sources and assessments. So we had all kinds of organizations, the OCHA, the usual humanitarian response architecture, and then came after that additional assessments that were done. And unfortunately, the community engagement part or any question that are relevant to community engagement are anywhere between 1 to or maximum 2 to 0. The second reality is that the absence of community engagement as an area or as a group or as a coordination in any formal mechanisms, aside from the RCCE, there is community engagement that was formed as a result of being part of public health emergency response. And then third, and another also critical reality, the limited number of national partners on the ground due to the long years of work that I just referred to. And then hence that also creates a lot of fragmentation in terms of our ability to respond and coordinate our effort on the ground. Planning for that, in my opinion, there were two critical questions now that we're reflecting on that. One is that what kind of social science tools that we could use in such a very pressed situation with all what I just mentioned as a background, and how could any of the intervention become relevant and possible to accommodate the actual needs on the ground. And considering more of a community-led actions, we had to initiate our own data collection and keep it as minimum and as short and use as much quick and less or least possible pressure on the communities and individuals who are already under a lot of stress in shelters. But one of the critical points were to ask to what extent those communities can really take it forward and be in a position to take forward any actions that would be co-created, as Rania just mentioned now, and what is the level of their perception of the solidarity of those communities. And to our big positive surprise, the ground was possible, or the possibility was there in order to work with the communities and be able to plan together some of those actions. And some of the other questions that we had to also ask is that to what extent there was readiness to help, and did the shelters, members of the shelters who at that time, this data was collected 3 or 4 weeks after the earthquake happened in some parts of Aleppo. And clearly there was an evidence of enough willingness to work and really pick up the situation again and bring it back to the level required. To reorganize ourselves, we have kept three major pillars that helped us to move beyond the classic community engagement work that was probably done before. One is to move from the RCCE concept of risk communication community engagement, as I said, built very much around health emergency response, into more of a social behavioral change and community engagement in its full sense, the way Rania described it. Second was also to look at the whole person concept, whether that is a child, a caretaker, a mother, a father, because that was the only way by which we could better appreciate and understand the whole social context that's around the people in need. And then third was revisiting the whole partnership and coordination platform. Again, from only looking at one disease outbreak into a much bigger stepping up kind of response whereby we had to relook terms of reference for our coordination, how we should better align our tools, minimize duplication, look at resources, map even our intervention areas. And as much as it sounds like basics, but a lot of that stuff was not there because neither the time nor the will was available previously to the earthquake to create such approach. We also piggybacked on what used to be existing from some of the cholera response, expanded that kind of dashboard for looking at some of what we use as third-party monitors. In this regard, we are very much using data or dependent on data that doesn't come across as the most scientific or as the most rigorous in terms of the methodology, in terms of how we collect the data. But of course, our eye is most importantly on the safety and security of those who are out there, and making sure that we just get any pulse from the community to hear and respond the way it should be. As you could see from the left side, we started seeing some shift from work around the only awareness sessions, the one-way communication, into gradually looking at more shifting into personal communication. That's the second role, and having confirmation by those who observe through the third-party monitors that those things really happen the way we would like them to see them happen. Additionally, we were very conscious of the gender dynamics and the fact that many of the communities where we work are becoming more female dominant, given the fact that they have lost the male figure in any of the previous emergencies, or they are not around for work reason. So to try to create as much balance as possible and to consider that in any of the intervention that we're doing was also quite important and critical. In my overall collective, before I conclude, reflection on where we are now after almost 3 months from a big moment of February 6th of the earthquake, I think we're left with 3 or 4 key areas that we have taken on ourselves to continue with in our emergency as well as development response. The first is relooking at the social behavioral change research tools and emergencies, and how do we ensure that even if it's more qualitative in nature, but appreciate that, improve on that, and make sure that the inquiry gets to be as scientific as possible in the simplest, most easy possible for those who also collect those data. And the second is how do we ensure that the data is feeding into our actions in many ways. The second pillar is about revisiting the whole SBC strategic framework and response, both in humanitarian context, to ensure that the humanitarian response is very much conscious and takes into account all the developmental needs. Going and pressing on more of local solutions can only happen if we're conscious of those needs. And the second is about strengthening the capacities that are available on the ground, given, as I mentioned earlier, the drain that happened to a lot of the capacities in Syria. And the third is the focus on the cross-learning. In some situations, for example, if we take the resort, the Far East governorates, in many ways inaccessible, it's not an earthquake-affected area. Nonetheless, it's among the most in need areas, for example, cholera outbreaks, a lot of the zero dose for immunization, a lot of early marriage issues. So you have different kind of learning that could happen, and the cross-learning could be. The third is the preparedness, which is a big agenda, again, that clearly from what I only see in the last 3 months of my posting in Syria, that emergencies in countries that have been just in a post-crisis situation as major as many of what I've just referred to, cannot easily put their guard down now. And they need to continue working on the preparedness in many ways and in different forms. And the last point is reconsidering the whole community engagement in the humanitarian response from the repositioning of that, from the coordination point of view, because if we don't put the voices together to ensure that there is the right clustering or the right coordination of the clusters, if it's a coordination group, even under the UN country team or in whichever other format, I do not think that a lot of the effort that is, for example, happening in Syria, or for sure in Turkey or in many other parts, would have the needed cloud and the needed visibility and support advocacy-wise to continue to move on. With this, I stop, and I thank you very much, colleagues, for your time and for listening.
Thank you very much, Sahar. And I think you gave us a really good overview of how you've managed to take the tools and the global goods from the SS for the social sciences for community engagement into the context of the Syria response. There was a very specific question for you that I'm just going to ask also because it's a question I would have as well, from Carolyn Davis asking, can you elaborate on why UNICEF moved from RCCE, which is risk communication and community engagement, to SBCCE, which is social behavior change, community engagement, and how your work changed with that shift? I don't know, Sahar, if that's a question for you or if it's for Rania or somebody else, but I thought since it was addressed to you, I'd ask it.
No, I'm happy to take that question. First of all, it's not Sahar or UNICEF who has made that decision. It was a group decision, that RCCE group, by chance. The earthquake happened, we cannot forget, on a Monday, and our natural meeting of RCCE was going to happen on the following Tuesday, immediately after that. And it was supposed to be something completely different of how do we prepare for cholera and all of that. And I remember on that day, I was the chair, and I just asked a question because of the shock that we were all in after the earthquake. Are we ready to step up? And we didn't know what would step up mean. As we evolved as partners, and this has nothing to do with UNICEF, we even had a whole survey that was open for a whole month. And we had several levels of deliberations and discussions. There was a consensus by the group that we do need to step up. Came after the idea of the name. The name in itself referred to a very specific concept of how do we do the response for community engagement. And it was very much, as I mentioned, linked to the concept of the health emergencies. The group felt that this is a time that we project a much bigger bracket for our capacities collectively, not only, again, as I mentioned, UNICEF, WHO, UNFPA, our national partners, everybody who is in the group, were actively promoting and advocating for this shift. Now, to answer the question, what it entails in terms of the response, if we're talking about a very pure health angle of responding to a health emergency, it remains to be, for example, if it's cholera, maximum within the health and the WASH. But for a mega scale as an earthquake, we were able to leverage and tap on all the resources, be it for UNICEF or other agencies, for example, for education, for community education, community engagement, for child protection, for the health, of course, for the WASH, but also as well for social protection, as well as our continuous coordination with the gender and the AAP groups. Unfortunately, and that's what I would end with, everyone felt that when we left the RCCE at the beginning of the crisis and we used that, there was a major misperception that we're only doing health work or wash work, when the reality is that we were trying to break through and support everyone and address all the needs as mentioned. Thank you.
Super. Thanks so much, Sahar. I'm going to leave some of the other questions till later so that we can hear from everybody else before we come back to some of the questions in there. So next, I am going to turn to, I'm sorry, I've now lost my spot, to Romeo Ngana, who is Community Engagement and Accountability Delegate in Haiti for IFRC, who's going to provide the perspective of the Haiti program. Romeo, please.
Thank you, Manisha, for this opportunity. I want to say thanks to all my colleagues with whom we have prepared or we have done all this work. I'm thinking about the regional office, social scientists and community engagement staff, and also the Haitian Red Cross who approve and allow me to do this presentation. As we are saying, we are going to talk about social science for community engagement, and we'll take the example of Haiti cholera response. Okay. Since the assassination of the president of Haiti in July 2021, insecurity situation continues to rapidly deteriorate. And we have a high rate of poverty. 90% of Haitians are living below the poverty line. We have also the increase of poverty as a result of the social political context and from the economic downturn associated with COVID-19 in 2020. The access to safe drinking water and basic hygiene and sanitation services is severely limited. And as I said before, we have a deep political crisis situation. The climate changes and disaster is also a part of the context in Haiti. And we have severe food insecurity according to OSHA 2023. Next slide, please. The first case of cholera appeared in Haiti in 2010 in October. And this epidemic was surprising as no cholera outbreak has been reported in Haiti for more than a century. 12 years after, in 2022, the national authorities reported the first 2 confirmed cases in the Port-au-Prince area. In October 2022, the USAID BHA project on building trust shift from COVID to cholera. What is the importance of social science in this particular context? Social science reinforce decision-making based on up-to-date evidence. And IFRC has articulated social science and information management capabilities within the CEA approach to elaborate comprehensive information product rapidly understood and applied in operation. By doing this, we assess the knowledge, attitude, and practices and impact of cholera on the population. We also inform the risk communication and community engagement strategy. The perception survey also allows us to know how to work together with community during this cholera outbreak and to provide appropriate solutions to strengthen community participation. Next slide, please. The perception survey was undertaken in 2 departments, the Sud and the Grand Downs. It was a quantitative survey. 190 survey data were collected in these 2 departments. The online training was done by the social science staff at the regional level. On the field, the training of 20 Haitian Red Cross volunteers was done, and they were working in couple. Regarding ethics, the consent of the participant for participation and data collection was done. Next slide, please. Some key findings. Regarding WASH, 61% of respondents indicate that they don't take actions to make water safer. Regarding vaccination trust, although 74% of the respondents indicate that they are tired of the cholera vaccine, only 19% claim to have received it since 2010. 80% have not received any dose since then. 42.11% of respondents say that they will not get vaccine even if they have access. Despite 76% of respondents reporting their mental health and emotional well-being affected by the recent detection of cholera, only 60% of the participants do not have access to mental health care and emotional well-being services. What is the socio-economic effect of cholera? 75% of respondents indicate that the recent detection of cholera cases has affected their economic situation. And for community engagement, 78% of respondents say that they were not involved in community activity in the last month. Next slide. How do the Haitian Red Cross is using these findings? Regarding mental health, the training of Haitian Red Cross volunteers is ongoing. The implementation of mental health community-based approach, delivering preventive and community participation activities is ongoing. Regarding community engagement, the mapping of vulnerable people, actors, stakeholder, and CBO, the use of existing trust interlocutors to seek entry into communities. And regarding WASH, the distribution of WASH kits to community. Regarding risk communication and community engagement, coordination meeting with other organizations is ongoing. The coordination meeting on cholera response with the Haitian Red Cross, the training of Haitian Red Cross volunteers, community-based organization on community engagement and accountability and risk communications, the approval for the publication of the finding and dashboard by the national societies, and the dissemination of the finding. Next slide, please. What is the relationship between building trust and social science? The understanding and use of effective evidence-based interventions that can change individual and community level behavior and increase vaccine demand. Social sciences strengthened evidence-based decision-making. This is why the National Society decides to focus on express and identify needs added to the activities underway on cholera response. This is a speech and from the Haitian disaster coordinator. We support humanitarian organization, the Haitian Red Cross and the Ministry of Health, Public Population in the creation and maintenance of feedback loops and the dissemination of findings and support to policy making. Next slide, please. The different challenge that we faced was timeline. With we decided the survey started on December for the first step, but the second start on February due to the context. Regarding logistic, we had a shortage of fuel, and we have also a high risk of humanitarian misconception due to COVID-19 and previous research. And the reliability and accuracy of data quality can be put on. The misunderstanding of the role of the social scientists, which according to people, some people is wasting time. And some success we can name the good planning and coordinations from the regional social sciences, the translation of some evidence of this survey into practices by the Haitian Red Cross, the publication of the finding and dashboard, and the dissemination of the finding with communities and humanitarian actions present in Haiti. Next slide, please. The lesson learned. The available network of Haitian Red Cross volunteers in all the target locations and who are also residents of their specific community made it possible to build trust and to carry out the perception survey in this context of insecurity. Risk communication approaches should also reflect local access and trust information sources. The perception survey brought out some underlying influencing factors which are and should be considered in the design of the rural response in collaboration with community. We also noticed that the use of funds for data collection was very important in this context of insecurity. Next slide, please. Thank you very much for your understanding, and sorry for the kind of connection network.
Thank you so much, Romeo. And please don't apologize for your connection challenges. I mean, you're sitting in Haiti and joining us, and it's obviously a very challenging context in which to work. So no apologies required. And really, thank you for joining us and talking to us about how the Haitian Red Cross has been able to use perception surveys and work with social scientists to be able to understand where there are challenges and be able to influence social behavior. And I think, a lot of what we do often requires a good understanding of what is happening in a population. And that there were some comments also about how you can bring in an anthropological perspective as well. So I think it's also mixing sort of the understanding of how populations are perceiving what the needs are, but also what humanitarians are doing. That's very important to be able to come back to ensure that we understand what needs to be changing in terms of our work. Fernanda, I'm going to change to you. I know that there's a number of questions that have been, and I admit I am also a little bit confused as to how the RCCE, SBC, community engagement, AAP, how they all fit together. So I don't know, Fernanda, if you're going to cover that, but there were some questions about, is community engagement part of accountability to affected populations? Is it bigger than that? Is social behavior change within there? Like, maybe you are going to be able to explain to those of us who are not experts in this field of, the social science element coming in, how all those different elements come in. Maybe I'll turn to you, Fernanda. And if you don't, then we can explore that more in the Q&A if that's not what you're planning on talking about.
Thanks, Manisha. Thank you. Well, I was going to kind of wrap up, in connecting a bit, what the colleagues were presenting as examples to what the work we've done. But just if you want, I can go quickly on your point, but quickly. It's a complex issue, right? But the thing is, like, what is community engagement? No, as we were saying it. Now, how do you define and then implement community engagement in humanitarian action in a meaningful way? Meaningful for, of course, the affected communities and at-risk communities, but meaningful as well for the programs. So there's this, two sides, let's say, that or twofold role that community engagement must play, in these situations. That is being something that is fit for the purpose and in a contextualized manner, in whatever context you are, in whatever kind of humanitarian situation you encounter yourself, in that humanitarian arena, let's say. So then how do you play that community engagement to be meaningful for the people and for operations? It has to play a win-win situation. If not, it's, I won't say irrelevant, but it's a humanitarian crisis, right? So then it needs to be fit for purpose. You have actors, stakeholders that are arriving to a place with resources, with means to be able to respond to a crisis. So then you have the at-risk communities and people affected. So how do you, put these two pieces together? How do you merge, or how do you bond or bridge these two realities? So for us in the project, as we were saying, there's the importance of understanding first, like, that kind of reflectivity process of like who we are, as humanitarians arriving to a place, starting from the person working, if you're working as social scientist, or if you're working in community engagement, who you are, what role are you playing, like your own background, that reflectivity process is an understanding, who am I being here, dropped in the middle of Haiti or Syria in my background, and what is my relationship with this situation, how do I fit into here? Then you move that reflectivity processes into the organization. Who am I with what organization? What is my role? What am I doing? How am I working? And how am I working in this big, situation, understanding what is at stake and what is my organization doing and what role do we play? Are we perpetuating, situations of power dynamics that are unbalanced coming from like colonial and post-colonial times? Like, how am I relating as a person, as my organization, and in this crisis with this particular situation? How is this playing? What is the role? And this is the work that we did, when we talk about the integration of that decolonial feminist approach, that understanding, that reflectivity process that needs to take place to place you, where you are and that particular moment in that particular context, right? Understanding all those dynamics and how, many concepts comes to mind here, like the do no harm, and that understanding of like the humanitarian principles, of course, but how all of that plays, particularly in that context where you are working, and how will that have an influence in the engagement process that you will establish, as an organization that arrives there, and as a social scientist or as a community engagement person, and for the programs and to connect with the reality of people at that place. So that entails that recognition of the system of knowledge that is local system of knowledge, and not saying that, oh, there's only one way of doing things. There's the humanitarian way of doing things. No, so we come with our baggage of humanitarian, principles and ideas and ways of doing, and we think that this is the way. And we not we, I'm talking about like this is the result of the work that we've been doing with all the partners and all the literature reviews and all the work that we've been discussing with lots of people, as Rania was explaining. Like, what is it like in many concepts of, for example, ethics, when we work on ethics, ethics concepts come from a European background, like European system of beliefs, so European understandings of what is right, what is wrong. Why do we have to take that as a global thing? European equals global, but that is not the case. Maybe there might be locally relevant systems of knowledge and understanding of what ethics is, and that are not, equal to what European systems, consider ethical or right. I give you an example: El Buen Vivir in Latin America, from Andean communities, or Ubuntu from Kenya, from Swahili peoples, right? It's a different way of understanding life and reality and engaging with that. So how do we humanitarians, deal with these things, and don't come as, oh yeah, we know everything. I know your problem. I have the solution, and I know how I'm going to give it to you. So kind of, that situation. So that take us to the understanding that you need to contextualize, and you need to come with that humbleness, let's say, and humility to understand that you are in a situation where you have resources and you want to encounter a different system of knowledge and people that are affected by a situation, but who have this knowledge that is contextually relevant. And we need to establish a dialogue. We need to engage, right, with this other system. But coming from this reflectivity process of understanding who we are and what we're doing there, are we perpetuating the status quo of inequalities, or are we trying to change, the system or the way we are working to improve the life of people, not only for that humanitarian crisis, but thinking, in the future, and how can we do the work that we are supposed to be doing in the best possible way? So that entitles for us, and as the result of the work that we did, understanding who you are, understanding who you're going to be working with, but at that level of equality, sitting and speaking at the same level, not coming, from a perspective of like superiority, of thinking like, oh, I'm here to help you, right? So no, let's help each other. Let's have a conversation. Let's talk in equal terms. Let's engage. Engage for what? To make sure that you are part of this humanitarian response, that you are taking back not only your voice, but your presence as community representatives and key people related to, the issue that is ongoing, how that people can be part of responses and decision-making processes, but systemically, and doing it like as a system, not as a tokenistic, like, oh yeah, tell me how you feel. I collect your data and then I present the dashboard and then it goes to where. Now, it needs to be systematic. And for that, following, the process that I'm talking about, we need also that system change. Sahar was talking about it, like where is the community engagement like cluster, or where is a platform that is systematized, that is officially, working on community engagement per se with all these political angles that I'm talking about, and that is systemically supported with long-term resourcing, with intentional and systematic and operational, support from the humanitarian community. So that is lacking. So this is what we think that is missing, what is next and where we should be, walking towards. Also, internally for us, people and organizations working in these areas, we need to come to terms. You were saying it, Manisha, like how many acronyms you have and ways of doing things. And no, we think this approach is the best, this other one. It's okay. At the end, it's like whatever works, but whatever works for people and whatever works to make things right and better, to deliver effective and efficient humanitarian action, which the mean is in an acute situation, save lives and do what is needed at that time. And then thinking in the future, in that connection, right? That connection with then after the crisis, what happens after, building up, but changing the system. Really changing the system and changing the power dynamics, which is at the end what matters. Because we're talking about here in our work, we give recommendations also to donors, like in how we think, not us, only UNICEF, as I said, this is a collective work, how we think the money should flow and where it should go to build up this kind of system that we're talking about, where we institutionalize, this system change, and we embed communities, affected communities and at-risk communities in the whole process, but really not by data, but by people. People are not data, it's people, and they need to be present and they need to have their voice being heard, but being present. So all the work that we did comes, to that conclusion. And I think Sahar was very clear, in mentioning all these points, that I'm talking about. So this is, but again, this is what we did. This is our work. Then where we are at now, what power do we have, to what voice do we have inside the humanitarian system? What credibility do we have for the ones that make decisions? Honestly.
We being who, Fernanda? UNICEF or the project as a whole?
No, I'm talking we, like, the people working on community engagement, risk communication, like the experts, from these technical areas. We're not really, we don't have power really, from the decision making, in the humanitarian system. We're not there. We're at the table, but to provoke this change, we've been working on this for years, and we're still like, I always say like we're like rowing on caramel, it doesn't move. But I think also we need, together we stand, divided we fall. Going back to the point on having, many different approaches, which is great, because there's one stage that you need to connect to your own organization, your mandate, and be fit for purpose for that. But then we should be able to come together and say, okay, to the humanitarian system, this is what we offer, right? And then we can, do it the way we do it for each organization. But we should have a face that it's a common face, for the humanitarian system, and try to make a stand there. So yeah, that was my point. I don't know if I answer your questions or what, but more or less that's the summary of all the work that we've been doing in these years. That it's been really refreshing and great, like, listening from so many different people from different backgrounds. So it's been great. Thank you so much.
Thank you so much, Fernanda. And I see we do have a lot of questions that are still out there open. So I am going to turn back to all of the panelists to be able to answer some of these questions. There are a lot of comments, so I won't necessarily go through them, but I think there are questions around, as you mentioned, is it about just looking at us as humanitarians, as organizations, or is it really looking at what are we trying to achieve through community engagement, was one of the comments that had been there. So I think that also raises a point that I just saw. Sorry, I'm trying to find all of them. There was a question around, the importance of localizing our perceptions through effective community engagement. And then there's a question of why do we do assessments, since this can explain and qualify us to have more engagement. And another question that's there, how are all these good points actually different and new from the core humanitarian standards, sphere standards, do no harm? So I guess what's the shift there? Because even listening, Romeo, to you about perception surveys, that's not necessarily the first time I've heard about that perception surveys have been used, but then how do the perception surveys change the way that we're adapting our programs? I think that's also the kind of question about where can we go with all that information. And then there was a question which maybe got answered, but oh no, here it is. Will this approach of using social science for community engagement or the social behavior change the way that we conduct research, collect data, and select tools that we're using to follow scientific research methodology used in the social and behavioral sciences? So also kind of the reverse impact. I don't know who wants to try to answer any of those questions. I'll throw it back to all of you. Anybody want to try? Sahar, you've raised your hand. Sorry, I can't see you for some reason.
I will not dare to answer all those critical
Just
questions.
one's good.
Yeah, but I just want to clarify one key point, which also, thanks, Fernanda, you've touched upon it. It doesn't matter what we call ourselves. I'm happy to be called A, B, C, D, E, F, G, or to be called Sun, Star, Mars, and whatever. What really matters is to be reflective of who we're presenting. And we're representing here. We're not representing. I can't even put ourselves in a position because nobody gave us that. But we are claiming to be working to serve the communities and to work with the communities. So regardless of what we call ourselves, what matters in my view is respect to the principles that we have set ourselves for. That's one. Second, which is something I do think that was a different point from what has been there before. And in my view, it was a breakthrough in the way we coordinate ourselves, is that we're not setting any of the agencies or the groups to do the work in any specific way. They can do whatever they like to do. The point here are 2 or 3 specific overarching principles that we have set for ourselves in that coordination group that's now being called SBC. Again, we've done a survey that then any decision comes by majority of the groups. Number 2, everyone has their own way of doing it, as long as we don't duplicate. We don't duplicate resources, we don't duplicate activities, we don't duplicate the same thing, because at the end of the day, as I said in my presentation, it's the same person, regardless of who's that person. UNFP could choose to go for the woman or for the mother, and UNICEF choose the child, but at the end of the day, it's the same house, the same door that we knock. And number 3, and more important, that we've set for ourselves, we're still on the way to that. I'm not saying we've managed fully, that we try to be as transparent as possible in terms of where we are hitting and what targets do we set for ourselves to avoid the point I mentioned before on duplication and maximize resources. I think over time, we're seeing a huge breakthrough because now more and more, some of the silent partners who've been in the group barely attending are the ones coming forward now and saying, hey, we're going in some of the most difficult places in Syria. Is there a tool that everyone has been using around X or Y or Z so that we could streamline some of that? That's exactly the point, that we stop using different things for the same purpose. We stop go differently to knock the same door. It doesn't matter how we do it. What matters is really have the same concepts and the same principles. And then the rest, in my view, is just details that are, on the contrary, nice to have. Thank you.
Thanks very much, Sahar. Rania, I see you've got your hand up, please.
Yeah, thank you so much, Manisha. And yeah, maybe just to add to, everything that has already been said, and particularly, the passionate interjection by Fernanda, because I think all of us here feel the same way and we're like-minded. The issue on the table is when we start to talk about social science for community engagement in humanitarian action, there is one major issue. Within the humanitarian system, there is no community engagement cluster. and hence everything that we've been talking about, it is everybody's business, and therefore it is nobody's business. So while speaking about standards, minimum standards, benchmarks, actions might sound very boring or limiting, it's very important because we are bringing in multidisciplinary, transdisciplinary approaches and saying that these are required for us to really focus. Are we within the humanitarian system and in our delivery measures? Are we really focusing on the right thing? How do we deliver? How are we respecting the dignity of others? What about the failure to act? And when we fail communities all the time, there is a systems problem. And so how do we hold the humanitarian system more accountable by improving community engagement measures and recognizing that it is complex? Social science disciplines are complex processes, but we owe it to apply these principles and to have these understandings and to bring this knowledge into play when we're particularly talking about community engagement and delivering with communities better, that it is a collaborative effort, and how do we transform the relationships therefore. So, I think that it's really important for us to think about that when we're framing, so why are we talking about standards, so many disciplines, how do we bring it? Now is the time for us to contextualize and operationalize and hold ourselves to account, whatever institution we represent, whether we are in an academic delivering research or whether we are within the humanitarian system. And also, there were many comments in the Q&A about how top-down the humanitarian system is. So yes, we might be talking about more people-centered, community-led, but what does that mean in terms of resources, financing? Where do the resources go? Are they going to community level and supporting community-led action that is already happening and working with platforms that are already existing? Are we really seeing that change within the system? And I really think that that's what we've been trying to bring to light through this session, to say that within the limitations of the existing resources, how do we drive resources to really uphold the ethical principles of humanitarian aid? So I just, as a reminder and framing of why so many standards, why benchmarks, why all of this, and why global goods, and what does that mean? It means that we need to do better in how we deliver and change the systems of delivery. Over.
Super. Thanks, Rania. Did anyone else want to come in on any of those? Romeo, please.
Yes, thank you very much. Want to talk about the difference between, because someone asked the question between the difference between the research in the normal context and the context in crisis. Something that I want to emphasize on is that there's some kind of limitation of qualified human resources in Haiti due to the exodus. Many people, qualified people, are traveling, going in other country like United States. That's a real problem here. Another thing is that many organizations have carried out some research and they do not share the information, the finding with the community. And now when you people are coming to carry out research, people are afraid because they don't know what they have done with the previous result of the research. Another thing is that sometimes you don't have the possibility to do the supervision of what is going on the field, because according to the security, you are not allowed to go where you want, even if some activities is going on. It's very, very difficult to us to go there. I also mentioned during the time, because we were supposed to carry out the research on December, but due to the insecurity, we did the first step on December and the second to February. That is some point that I wanted to mention. Thank you very much.
Thanks very much, Romeo. Jeff or Ginger or Fernanda, did you want to come in on any of that?
Thanks, Manisha. Just quickly on one of the questions, I guess, was, what have these different initiatives in the social science data changed in practice, or whether they're highlighted changes in the way things are done. I think a good reflection here that, has been mentioned today is that, these areas, social science, behavioral science, and bringing community data kind of help us highlight many things, including, any potential gaps between the way the response is designed and how communities see them. but they can also help unlock some sort of sensitive issues that have been highlighted in the chat, coming back to these power dynamics and imbalances that exist, coming back to reflecting about giving the agency back to local communities and so on and so forth, and who is willing to do that when, and what type of investment is being done for that. So I think these areas are very important for that, but that's one thing, that's one part, that's about bringing the evidence on board. Acting on evidence is something else. Acting on evidence and changing, not only practices and behaviors, but also institutional and organizational ways of working, ways of doing decision-making takes time and comes with many conditions and features in place. So that, going back to what I think Rania and Fernanda also mentioned, that comes and highlights some sort of, dependency from research results / researchers by those who actually are in position of changing something. Few things we try to do in order to minimize this gap for sure, and one of them is every time we think about doing social science research, we have to ensure that the research is operational. It's operational, so that it's not built on academic needs, but very operational needs, and it's framed and designed with those that are working with communities. So this was the case of Haiti and Syria as well. But we know that, there will be a certain level that will need further engagement and institutional engagement so that things and mindsets can change. And this relies and depends on everyone's efforts, not only, on researchers / community engagement leaders and implementers and practitioners, but also thinking about, the whole humanitarian architecture and the willingness to kind of reflect about some of these key issues and take decisions to change some of them.
Super. Thanks very much, Jeffra. There was a question where somebody in the chat noted that in psychology, there's also, and social psychology, there's theoretical frameworks that could around mob engagement, crowd mentality, but that social identity and other constructs that could be highly informative to this approach exist, and how could these be integrated into humanitarian work? And there was also another comment about how programs in academic and humanitarian learning streams teach about decolonization, intercultural practices, and transdisciplinary approaches for community engagement. However, those concepts don't necessarily transition easily into working in the humanitarian sector, which I guess goes back to what several of you were saying, is it's about really having that reflectivity, a reflection and a kind of introspection about where we're coming from, how we fit into the work that we're doing, and what we need to be doing to be sure that we're more focused on really finding ways to engage with communities in a systematic and meaningful way. And it's interesting because in this morning's session, one of the things that came out that links to your point, Romeo, about people being scared to talk to researchers because they don't know what came out of it, was the need to really work with communities so that all of that sort of, when we do assessments or when we're collecting data, that we go back and really discuss with communities and populations what we're doing with that information, explaining why we're collecting it, whether it's to go into a project proposal so that funding might be available, but it may not be available. And we don't take enough time to really explain many of those things. So I think that's also an interesting link there. But I think I think with all the acronyms, it does get a little bit kind of that alphabet acronym soup that we like in our humanitarian community. I have to say within the AAP space it keeps growing. Every time I'm in many of these, there's another acronym, because I was just thinking, what happened to communicating with communities? Because that was another one at some point. And has that sort of come subsumed underneath as well? Or is it all sort of the same with just slight variations?
Can I?
Fernanda, please.
Yeah, just, no, I think it's, it has, parts that are common in that. I just wanted to say something, because based on everything that everybody's saying and what you just mentioned now, like, like the first, I think, change that needs to take place is inside the humanitarian community, as you were saying, right? So for us, working in these technical areas, I think we need to focus on how to engage with humanitarians, internally. How do we do this community engagement internally, understanding, other technical pillars, understanding coordination, understanding their needs, their priorities, and then trying to see how we can bring about social and behavior change inside the humanitarian community to be fit for purpose, like for that change that we're talking about. But there's a lot of work that needs to happen internally first. Even us, as you're speaking, Manisha explaining, we have all these different ways of seeing things. We have, everything is fragmented, and working in silos and pillars. So it's very difficult to think in life, in these terms. Like, think about the affected people. They see you, they don't understand all these things and all these divisions and like, no, we're coming here for this organization, this mandate, this CEA, this CWC, these people affected by a crisis. They see you as, okay, people coming, let's see what's going on. It's a different, that perception, but that understanding of what is that is happening in terms of aid that is coming together. So for us, I think also we need to do that analysis and that engagement internally. How do we speak the language of decision makers? How do we speak the language of, and I'm not saying by this that we accept, that's the role also of social sciences, try to, reflect, make them reflect on themselves and seeing that, hey, maybe that's not the way, but not only the way in terms of social justice and, people participation and, their dignity and all that is in the speech, right? But I'm talking about being effective and efficient in what you do, like using the resources properly in humanitarian action, not wasting your time, your resources, and security, because that is a key issue, right? So that's the thing. It's a win-win situation, really. But I think we need to think thoroughly, how do we articulate ourselves when we try to negotiate with humanitarian decision makers? We're not having the right speech, I have to say. We're not really talking, we're not establishing a meaningful dialogue in that engagement. We are just talking to ourselves, like how great social sciences are, how good we are, how important it is, and we talk for communities. Yes, right, but we don't talk for them, and they are the decision makers. They are the ones, the gatekeepers, the one that will open the door or not. So I will argue, and I will continue arguing, that we need to establish that dialogue, to really be able to understand that community, understand the power holders, understand their dynamics, their language, and then we want to penetrate in that world. We want to have, say, for instance, a cluster, or we want to have sustained, support with resources, in a systematic manner. But then we need to start, entering the system and speaking the language and understanding. And then once you're inside, being the rotten apple, you can start, bringing about change, But I think that engagement needs to take place, before, all the rest. And I don't think we are aiming at that, Thank you.
Thanks, Fernanda. And I think that's maybe a nice segue into what Jeffra is going to talk to us about, which are some key action points to foster the use of social science in humanitarian action. But I think that point, Fernanda, around how we articulate ourselves around these issues with decision makers is something that came up this morning also in the data session, where it was, how do we make data accessible? And I think, decision makers often have a lot of information coming at them that don't speak the same language as social scientists do, perhaps. Romea, can I ask you to come in very quickly, because we're running short on time and I want to make sure we've got time for Jeffra to come in, please.
Yeah, okay. Yes, I was just talking about how we discuss with the community about the framework. I think we have started to have some workshop with the community-based organizations, some stakeholders, and some regional community of the Haitian Red Cross, during which we share the findings of the survey. That's what we have already started. And with the other organization, we share the data of the finding of the survey, like UNICEF, PARO, all these organizations, even Médecins Sans Frontières, we share all this information with them. Thank you.
Super. Thanks very much, Romeo. Jeffra, can I turn to you when you're going to talk to us about some sort of what we can do next?
Thanks, Manisha. Thank you so much, colleagues. This has been like an interesting day and reflection day. And I think one of the things that we've been all thinking about as we discuss this issue is that, studying human behavior and how individuals and communities interact with the response, or, in case of any humanitarian crisis, is really important. So we all acknowledge that we should focus and we should localize the response, and communities should participate from the outset of the planning. But we also have to acknowledge that, humanitarian organizations most of the time kind of fail in the way they recognize the importance of using these tools, these social science and behavioral science, but also using the amount of social and community data that comes from the ground and make decisions on that. Of course, there are like many gaps and many challenges, including the way they understand the processes, like you were saying, Manisha. But there are many other things that we could be doing together, and I would like to highlight here in these few slides. So in summary, and also it's good to see that these summarize some of the reflections in the chat and some of the things that we discussed here today. First of all, to enhance the contribution of social and behavioral science in humanitarian action, we have to build consensus about the importance of these things, about the importance of bringing evidence from communities about understanding their perceptions and their needs and priorities, and ensure that we avoid excuses related to seeing social science as a complex thing that is very academic, because we are here to show that there are several ways of doing it that can be rapid, that can be easily applied into action. So let's do it together, and let's embrace this area if we actually want to localize the humanitarian action. Second, we have to strengthen the application of social science and community data across the humanitarian program cycle. And we know that when this is done, there are massive gains. We have seen, especially these gains on public health related issues, like we saw with Ebola outbreak and also recently with COVID-19. But we know that public health emergencies and the humanitarian crisis and the disasters are all intertwined. You cannot build the boundaries. So we have to ensure that the application of social science and behavioral science, is there and across the humanitarian program cycle. Third, we have to legitimize and value the contribution of community feedback, qualitative data, which is something that is not well expanded because we are great at doing surveys, but sometimes we miss the context, the history, how people live, how they think, and the other factors that influence their ways of thinking, their behaviors in accepting some of the services that are being offered. So we have to unpack and expand the type of evidence that is there, and also consider qualitative studies, and also listen to communities through community feedback and other types of listening. And the fourth point I wanted to bring in terms of what we can do together to improve how social science is applied in the humanitarian action is what some of you have already highlighted. There is a need of shifting the mindset and shifting away from the colonial and Eurocentric view towards a more localized and community-based approach that truly prioritize what communities need and what their concerns and priorities as well. And the fifth point, also related to that, is on the need to recognize the value of coordination among humanitarian organizations, in sharing information, but also see the value of using different types of disciplines. So thinking about interdisciplinary encounters and how this can help, to bring some sort of robust evidence on how communities act and how they think locally, and use this type of varied evidence to inform some of the operational, some of the programs and operations. The sixth point I want to highlight is the need to establish or reinforce organizational ecosystems and structures. So thinking about those structures within your own organization organizations that are dedicated to social science and to behavioral science research, or to bringing community data. Maybe the question would be asking everyone, if are there such structures and units in your own organizations dedicated to these? If yes, how do you see the way they are prioritized if compared to other units? And the seventh point, of course, as we move forward, is the need to invest in long-term positions and expertise. And this comes, of course, with the need of securing positions of those who work on social science, behavioral science, community data at different levels, at a very local level, and improve their capacities to collect, analyze, and act on data, but also at the regional level and at the global level. We have to ensure that we have positions to work on some of these matters. And the eighth point out of 10 is the need to standardize some of the tools and ethical frameworks, just like it has been highlighted here before, and ensure that, as we do this, we decolonize these tools, SOPs, and these guidelines so that, interactions with affected community will be fair. The ninth point is the need to tackle what we call evidentiary inertia, or the need to turn data into action, because collecting data is easy and it can be done by everyone is trained to do that. But acting on data is more complex, as it's been highlighted here. And finally, we have to ensure sustainable funding for social science, for community data, for social listening, for community feedback mechanisms, by securing regular funding, but also investing very seriously in funding outside specific programs, and ensure that there is funding available for rapid response. So these are some of the 10 highlights and points that we take as key messages to share with you. And I think they summarize some of the reflection that came in this session. Thank you so much, and apologies for the noise in my background. Over to you, Manisha.
Thank you very much, Jeffra. And I think you've given us a number of sort of ways that we can take this work forward. And I think you've all provided a really great overview of sort of how the social science research is being able to influence at a practical level with the cases of Syria and Haiti, but that there is still a lot of work to be done. And I think that point, Fernanda, about really trying to make sure that we're able to have these conversations translated in a way that is understandable to decision makers is really key. So making those messages easier for them to understand, because it's the same as this morning's conversation where they're busy people, they don't have time to absorb all this information coming at them from specialists. So it needs to be distilled in a very kind of succinct and short manner so they understand the importance of it, so that it can also be made part of really ensuring that we can provide that meaningful community engagement that we want. And just to point out that Ginger has noted the global goods that were referred to at the beginning by Rania, that those are going to be available and shared soon by May. So if anyone would like to receive those documents or resources, please share your name and email in the chat, or just your email, and you'll get added to the distribution list so that you can use those as well. Huge thanks to all our panelists, Sahar, Romeo, Jeffra, Fernanda, Rania, and Ginger for answering all the questions. Thank you to all of you in the audience for posing lots of great comments and questions throughout the session. Just to draw your attention also to the upcoming sessions again, tomorrow afternoon at 2:00, Geneva, we have empowering frontline staff to deliver accountable and locally driven humanitarian assistance. Launch of the Accountability and Inclusion Help Desk on Thursday, and what will it take? What should we change for greater accountability to people in crisis? The title has changed for the one on Monday at 4:00. Huge thanks also to the IAC Task Force for organizing these set of AAP sessions, and to PHAP for doing all the background work and making sure that everything works smoothly. Thank you again to everyone, and I wish you a wonderful rest of your day. And hope to see you tomorrow at our next session. Have a good day.